Good afternoon. This is Congressman Jeff Fortenberry calling. Thank you so much for your willingness to spend a little bit of time with me today. We're doing a live telephone town hall to talk about coronavirus, COVID-19, and I have a special guest with me today, Dr. Jeffrey Gold, who is the Chancellor of the University of Nebraska's Med Center. I'm going to delay for just a few minutes and put you on standby as we allow more people to join the call. Again, I'm calling Nebraskans today. This is Congressman Jeff Fortenberry for a live telephone town hall. So if you'll hold just one moment, I'll be right with you and we will begin our discussion. Okay, again, everyone, good afternoon. This is Congressman Jeff Fortenberry. Again, thank you so much for those of you who are on the line. I will delay for just a moment until more people can join us. We are calling Nebraskans to have a live telephone town hall to talk about COVID-19, coronavirus, and our public health response. And I have a special guest with me today, Dr. Jeffrey Gold, who is the Chancellor of the University of Nebraska's Med Center. And I'm going to give a little overview of a couple of dynamics that are happening in Congress that are important for you to know as we fight back this virus in order to maintain the integrity of our healthcare system, find better treatments and cure those who are ill, as well as secure our economic well-being. I recognize that this is just such a traumatic, difficult time causing so much suffering for so many people. Please know that my staff and I, we are here. We are here to help. Whether or not you have a problem with Social Security or disability, or you haven't gotten your stimulus check, or whether you're a farmer working through a loan program or a small business working through the Paycheck Protection Program, we're here to help, to either answer your questions or get an answer for you. And so while many Nebraskans are listening, I want to publicly commend my own staff, both here and in Washington, D.C., who are, again, working tirelessly to go person by person, farmer by farmer, as we work through these problems. Again, we're here to help. So I'll get started with an overview of some of the issues in Washington, D.C. And again, this is Congressman Jeff Fortenberry, and I want to thank you so much for your willingness to join me for this live telephone town hall as we discuss the impact of coronavirus. I have Dr. Jeffrey Gold on the line with me today. Dr. Gold is the Chancellor of the University of Nebraska's Med Center. Dr. Gold is an expert in a variety of things. Originally as a pediatric cardiology surgeon, now runs one of the premier medical institutes in America right here in our backyard. The University of Nebraska has taken a leadership role in fighting coronavirus and infectious disease in general. Many of you may realize or remember a few years ago when Ebola was raging, Nebraska played a key role in building out biocontainment facilities. In fact, we worked with the last administration to help in that effort to position the University of Nebraska, again, as America's leader in infectious disease control and containment. That's why the first Americans who were impacted by coronavirus came to Nebraska and were hosted by our National Guard, isolated at the University of Nebraska. The University of Nebraska also continues to work on more effective treatments and vaccine research, and there's a special program that I'm going to announce shortly. So again, those of you who are joining us, just getting on the phone, this is Congressman Jeff Fortenberry, and we're doing a live telephone town hall today. I want to thank you for giving me a little bit of time. First of all, I want to announce some news. The United States Department of Agriculture, I spoke with the Undersecretary today. He called me. We've worked on an issue in order to be able to support our farmers and ranchers more robustly during this very difficult time, in which many prices for crops as well as livestock have collapsed. During the last CARES Act, we moved about $10 billion for direct assistance to farmers and ranchers, added additional monies in that through the Commodity Credit Corporation. We also targeted about $3 billion for those with food insecurity. And what that means is USDA is now actively locating food that would be potentially wasted and then moved into care packages that could be distributed to those who may be with food insecurity. I tell you, recently I was at a food bank distribution site, and of course I've been to those before and have watched good-hearted people give away food, fresh food, to those who are particularly in need. This was different, though. There was a line of cars a quarter mile long. As the development director of the food bank said, people who have traditionally volunteered for us are now needing our help. I recognize how difficult this is for so many of you, so many Americans, and we're all doing the best we can to fight through it. And your federal government has issued a massive airlift in terms of help for our healthcare system, protecting individuals and families, as well as protecting small businesses and farmers with the last federal package that was over $2 trillion. We do have the announcement of the economic support package for farmers and ranchers. It was announced today. If you are in agriculture and you think you may be in COVID, coronavirus has significantly impacted you, you probably will be eligible for a direct support payment. The details can be found on the USDA website, farmer.gov. So go there for the basic construct of how this program is going to work. And next Tuesday are the sign-ups. So in about a week, you can sign up for the direct payment if you're a farmer, or rancher, or an associated agricultural production business. A second issue I wanted to talk to you about is the problem that our state and local governments are having with meeting their obligations to provide services. I am in active dialogue with the two mayors of our two major cities, Lincoln and Omaha, and our cities are hurting. It's not their fault that this pandemic swept across America and hit small businesses so badly. And when you have this negative economic multiplier, what that means is there are less sales tax revenues. In Lincoln, for instance, where I live, about 50% of the local government's funds come from sales tax revenues, and those are going to be way off. So in the last bill that we passed, we provided very significant help to the tune of about $150 billion, to state and local governments that are over 500,000 people. Well, we don't have those in Nebraska, so there is concern from our local municipalities as to how they are going to get through this crisis. Congressman Don Bacon, who represents the Omaha area, and I have been working on something we think is very important, and we're nudging toward formalizing this. Both of us have appealed directly to Secretary Mnuchin, the Secretary of the Treasury, to use the existing funds that have gone to states so that he can interpret that in a way that allows for local governments to pay for police and firefighters and first responders, a big portion of local government services. And again, they've given in a question and answer. Let me put it differently. The Secretary has made public pronouncement that local municipalities can use those funds for first responders, police and firefighters. We're asking the Secretary of the Treasury to formalize that guidance so that governors can have absolute assurance that this is an appropriate use of the federal funds. So we have public statements in that regard. We have some basic guidance, but we need the formal guidance. So Congressman Bacon and I have both petitioned the Treasury Secretary directly. He's responded, again, with his own public comments. I think this is a good dynamic that will help use existing funds that have already been appropriated to go toward some help for local governments that, again, through no fault of their own, are having an unwinding of their tax revenue base and are going to have trouble meeting local government services. It's very important, though, to make distinctions about certain things that I will not fund. If there was a crisis in local government, which in Nebraska, local governments are generally very well run. But across the country, you can't say that. So I'm not going to make Nebraskans pay, for instance, New York's problems in their pensions fund or New Jersey's issues that existed prior to coronavirus. It's not fair, and we're not going to do that. But allowing some flexibility in the existing funds, which have not all been spent, to go toward local services like police and fire, in my mind, makes good sense, and hopefully we can consolidate that understanding shortly. On the final point, again, the first two were farmers and ranchers. The support payments are coming. The sign-up for that is next Tuesday. Just go to farmers.gov on the website, the USDA website, farmers.gov, to look at the basic construct of the program. Second, some additional help for state and local government. We're aggressively working on that, as is appropriate, and we've got good movement in that regard. And third is, again, I want to introduce Dr. Jeffrey Gold, who is on the line with me. Dr. Gold is the Chancellor of the University of Nebraska's Med Center and has just done a tremendous job leading our nation in terms of the response to the infectious disease. And there is a new dynamic rolling out at the university, which is a suite of products, best practices that a business or an institution can undertake, and I call it SSTT. And what do those four letters stand for? Well, screening, sanitation, testing, and testing. So basically, screening to see if anyone has COVID-19. Sanitation are the basic hygiene practices and social distancing practices that have been implemented within the business. Testing means to test for the diagnosis of the presence of COVID-19 if someone thinks they've been exposed or are showing symptoms. And finally, testing for the antibody. And what does that mean? This is really important. If you draw someone's blood, we can test to see whether or not you've been exposed to the disease and therefore have some degree of immunity. The big problem with COVID-19 is there's no natural human immunity. Some people have actually gotten it, and maybe Dr. Gold can share the general statistics with us. Some people have had the disease and never knew it. Some people currently have the disease and don't know it and are spreading it. Some people have had the disease and are very ill. I've had a staff member of mine get COVID-19, and he's a fairly healthy, middle-aged man, but he is in his fourth week of recovery, and he's still not been able to shake it. And I honestly, the first week we didn't know if he had it or not, but when an adult who's in middle age has 104 fever, there's something wrong. So I'm glad we found out that he did have it, because then appropriate treatment could take place, and he's getting much better. And he didn't mind me sharing a little bit of basic detail with you all in this regard. So there's different categories of people who have either been exposed, have had it, had no symptoms, didn't know it, and now may have the antibody, a natural type of immunity against it. It doesn't provide complete immunity. They may get it again in the future, but it provides a level of immunity, and that's important to know, because obviously they can go about business much more normally than perhaps someone who has an underlying disease, a comorbidity as it's called, a condition which makes them much more vulnerable to the possibility of the onset of the disease. This morning on the phone with an epidemiologist, he was basically going over some facts that a lot of you all know. The highest categories of vulnerability are persons 65 and older, men, those who have cardiac problems or diabetes or some type of other hypertension, lung problems. Obesity plays the major role in the onset of the disease in young people, even though young people are generally less susceptible to it. And about 40% of Americans fit into that category. So as we move forward, obviously, we're trying to do two things at once. Ensure that our healthcare system has integrity and is well positioned to take care of those who do get sick and to race toward better treatments and a possible cure or vaccine, while at the same time moving prudentially toward reopening our economy so that we are managing the disease and managing our economic well-being at the same time. It's a difficult thing to achieve those two goals. So I'm going to now ask Dr. Gold if he'd be willing to give a few comments about, again, the dynamic work that the university has undertaken, particularly with the rollout with their new suite of products, our new suite of options that an institution can use, again, to assure that they have best practices internally in the organizations to prevent the disease from being spread, to take care of employees, and to set up the facilities for testing. So, again, Dr. Gold, thank you so much for your willingness to spend a little bit of time with us. And, again, for those of you who can stay on the call, if you'd like to ask me a question, press 0 on your phone. If you can't stay on the call, press 1. Leave me a message, and I'll be happy to review your question or concern, and if necessary, we'll get back to you. So thank you so much again for being on. Dr. Gold.
Well, thank you, Congressman, and I'm also very willing to take questions from our group tonight a little bit later. But to answer your question specifically, the UNMC, the University of Nebraska Medical Center, has been asked by so many different organizations, everybody from the K-12 school system to daycare centers, the higher education world in universities and colleges across the country, and large and small businesses alike, to provide guidance, to provide judgment, to provide some best practices regarding how they can safely reopen. And they have questions that vary everything from mechanical and engineering issues of air exchange, whether or not they should open or close their windows, how often they should sanitize bathroom fixtures, doorknobs, and table surfaces, what they should do in their food service facilities, and on and on and on. What they should do about the use of personal protective equipment, think masks and other features, face shields, and what they should do regarding testing. And you've done a very good job, sir, of describing the different types of testing that are available, particularly the increasing important role of antibody testing to look for immunity. And then ultimately, they're going to want to know about screening and about the use of vaccines, because as we start to have access to both safe and effective vaccines, it's going to be important to roll them out in a careful and thoughtful way. And so the university has risen to that occasion. The university has offered several different types of what we call playbooks or guides. They're not meant to be prescriptions or curative in any way, but they're meant to be a guide on things to consider. We like to talk about them as checklists, things that the meatpacking industry might do, things that the publishing industry might do, things that high schools, colleges, the K-12 system might do, and on and on. We've actually put together a whole series specifically for work we're doing with the Department of Defense and other areas. And so this is really a new role for the university in the sense that we have been in assisting many different types of organizations for many years, but it's really been in a one-off kind of way. And now the demand has just gotten so high, Congressman, that we've been really in a position of having to get it organized, be sure we have the right staff in the right places, build public-private partnerships, so that when we get these questions, we can immediately say, yes, we're here to help you, and this is what we can do. So I hope that's at least a preliminary discussion, and if you'd like to go in a slightly deeper direction, please let me know.
Dr. Gold, thank you so much. It might be wise at this point to go ahead and start taking questions, and then as we take questions, we can unpack both the services that are available at UNMC. Again, I think you're leading the country in providing this suite of services, this template that can be used by so many different types of facilities. I hope you don't mind, Dr. Gold, if I hope this doesn't embarrass you, but to everyone on the line, Dr. Gold told me something recently that I think is very important. They are there. They take care of the sick. They are a leading research institute, but now they are turning outward and taking the services out to you. And this is important for any of you who may be in a position of running an institution or in a position of running a business or in a position of authority in one of these broader institutions. I would very much encourage you to reach out to the University of Nebraska's Med Center, their Global Center for Health Security, which is running this program. And so with that, let's go ahead, Dr. Gold. And again, I want to thank you so much for your precious time today. It's very helpful always to hear from you. Let's go to our questions, and then we can continue to unpack issues. Terry is on the line. Hi, Terry. Are you there?
I am. Thank you.
Hi. Yes, ma'am.
Yes, for the doctor. I picked up that you're in infectious control and containment. I've been concerned because I keep hearing only one goal. In fact, I just got a response from the governor, and he continues to say, as though his only goal has been to preserve the integrity of Nebraska's healthcare system. And anytime it seems that things are brought up about containing and controlling and lessening the spread of the virus, then it becomes, as long as our hospital systems aren't overrun, we're fine. This is the idea that I keep getting, and it just seems like containment and control is ignored. And one of the things that has bothered me, in fact, just with describing best practices is a kind of just ignoring about the public wearing masks. When it's actually the virus is most highly spread by speaking, coughing, and sneezing. And
Terry, Terry, if it'd be all right, let me go ahead, and since there's a lot of people wanting to ask questions, let me go ahead and if we could take the first two things that you've talked about, containment and control, as well as wearing masks, if that'd be all right. I'd like to just get into that a little bit because those are great questions, if we could. So I'll start there, but then turn it over to Doc right quick. Terry, let me just review for everyone why this is so complicated, because we have both a centralized and decentralized system. We rely both on the public sector to make decisions and have certain authorities in this regard, as well as the private sector to provide supplies. And so if you wonder who has the authority here and why is this so complex, the answer is yes, all of the above have the authority, and yes, there are numerous layers that add to the complexity. For instance, at the federal level, the president has at his discretion the Defense Production Act, which he invoked to start to make the respirators, which was an early response to this. And then early on, again, the first idea was we have got to make sure through social distancing, as well as a rush to things like respirators, that our hospital system, our healthcare infrastructure was not overwhelmed by the flood of the pandemic over our population. Since then, we've moved more toward the containment and control strategy, at the same time moving more toward a better understanding of what treatments are realistic out there, what vaccine possibly looks like, as well as understanding what groups of people may have deeper vulnerability to this than others, and that informs the decision-making, particularly at the governor's level and local health department levels, as to how you can open economically with appropriate protections. So there's a lot of complexities there. So I don't think it's being ignored, containment and control, but you're right, the early emphasis was appropriately on making sure our healthcare system was not overwhelmed by the disease. And fortunately in Nebraska, we have a very good system and capacity-wise. Secondly, I'm going to let Doc go into the wearing the mask. You're right, this is airborne virus, and that's the way it's spread primarily.
Yeah, so Carrie, first of all, I very much agree with your comments about containment. You know, when we watched what happened in Europe and in China early on in February and early March, they overwhelmed the healthcare system, and a lot of people died or were very seriously sick as a result of having their healthcare system overwhelmed. So it's not surprising that that's one of our primary goals in trying to contain and eradicate this virus. But we're working very hard across the state of Nebraska to do as much testing as we can possibly do and to do contact tracing, which leads to isolation and quarantine, which is all about containing the spread of the virus. So you're right on. In answer to your question about masking, in use of both disposable and non-disposable masks, let's just say I wear them in public when I'm in the grocery, the pharmacy, when I'm waiting in line to get gas, whatever I'm doing, I do wear them because, first of all, it protects others from droplet spread infection, and that's very clear. And secondly, it protects me because it's a constant reminder not to touch my face and to make sure I'm washing my hands and maintaining my appropriate physical distancing. So I think it is particularly important in respect for others, particularly for the older and the more vulnerable populations, those with, as Congressman said, diabetes and lung disease, obesity, and other conditions. We should wear masks, and at least until we can get the virus spread down to a lower level.
That's well said, Doctor, and especially the point that sometimes we forget, it's also very much about others because some people with coronavirus, with COVID-19, don't know they have it. Some people who have it will never know they have it because they don't have any symptoms, and they can be spreaders. The interesting fact, too, an early fact that I think still holds, is about 80% of people who have it will never spread it to anyone. About 19% of people who have it will spread it to 2 or 3 people. And then it's that 1% that's in some closed, contained area who is a super spreader that would give it to 5, 10, 50, 100, 500 people, and that's how we've seen the numbers go up so rapidly. So, again, it's also about being aware of the need to protect others from yourself in case you do have it and don't know it. So let's go now. We're down to the question and answer portion. Again, this is Congressman Jeff Fortenberry talking to you today with Dr. Jeffrey Gold of the University of Nebraska's Med Center. Dr. Gold is one of our nation's leading experts in the healthcare response to COVID-19, runs a major system. He's also Chancellor of the University of Nebraska, Omaha. He's got lots of jobs, but he's working tirelessly to help lead Nebraska as well as America as we fight our way through this. Let's go to Harold. Hi, Harold, are you on the phone? Good afternoon,
Hello,
Harold.
This is Joan.
Hi, Joan.
This is Joan.
Yes, ma'am.
I was wondering, I'm a paraeducator at a school in Columbus, Nebraska. When school starts this fall, will we have to wear masks and everything? Will we have to check everybody's temperature?
Yeah, let me ask Dr. Gold to weigh in on the likelihood of that.
Yeah, so Joan, at the moment, I would say the answer is probably yes. I think that we think of it, just speaking now, putting on my hat as a chancellor of the university, is we're planning a multi-step opening process because we are planning, as you may have read in the newspaper, to have on-campus and remote education options available for the fall semester. I can't tell you when people will sit in their seats in Memorial Stadium just yet, but we do plan to have students in classrooms, teaching laboratories, etc. So in order to do that,
how are we going to do that with lunches at the school?
Sure. Well, lunches are. We'd be very pleased if you were to look at the GCHS, the Global Center for Health Security website. We can provide you with a lot of different material, but obviously for eating and many other things, wearing a mask is not going to be possible. And that's going to mean some distancing between students who are having their lunch, and very good sanitation of table services, service materials, certainly masking of the staff that's going to be involved in it. And we're going to have to do our best to do some appropriate screening of students before they come in, ask for their parents to help as well. And, we're sort of all in this together. And we just need to get through the early stages of this to create a sense of safety that we're not going to cause an expansion of the spread of the virus. Once we get to that point and the numbers continue to fall, all of that will become less important. But we've got to create this very strong message about safety in our schools, churches, restaurants, etc. And that means we have to be respectful of all of these non-pharmacologic interventions that have worked so well in our communities.
Okay. Great, Joan. Thank you so much. Your question begs another question, just so that I can perhaps be a little clearer. There are multiple levels of authorities here. So ultimately, your local health department, in coordination with the state, is going to be the primary resource for giving you the determinations in that regard, with guidelines from the federal government. Obviously, I'm your federal representative in Washington, and so we are there running the agencies that are going to give you guidelines, funding those agencies, and funding certain aspects of this, such as equipment and support for state governments. You've seen the stimulus, economic support payments that have come to a lot of Nebraskans, as well as support for small business. So there's a varying roles here. Your local health department will play a key role in those decisions there in Columbus. So let's go to James. Hi, James, you there?
Darlene here.
Oh, hi, Darlene.
Yes, I have a question. We have a wedding in the family coming up towards the end of June. Do you have any idea of how this can be taken care of, or can they go ahead and have any reception of any type, or anything on that order?
Darlene, I'm starting to get mail about this in my own office. Again, I'm your federal representative because this is June, the month in which people get married. My own anniversary was July 6th, but we couldn't quite squeeze it in June a number of years ago. But Doc, could you take that question and just talk about the basic guidelines that are in place now and what's likely to be there in June, plus what are likely to be best practices for those businesses? Not
Sure.
businesses, both churches as well as social halls.
Sure. So I think most people that are planning June weddings and even July weddings are thinking about doing small groups, video connects, Zoom, those sorts of things, and not having large groups with large receptions at this time, just because there's a degree of uncertainty as to where we will be in terms of the spread of the virus, and also there are certainly financial and travel obligations that people have, particularly for large wedding, graduation ceremonies, and things of that nature. I do believe, certainly here in Nebraska, that the numbers and the rate of spread of the virus will have peaked by June, certainly by mid to late June. However, I think the uncertainty of that would really be the better part of valor. What a lot of my friends and colleagues have been doing, and their kids made a decision, is they plan to host a celebratory event either in August or in September, and either have their ceremony at that time or have their ceremony in June, but do it with a smaller group and connect electronically. May not be what they had planned, but it probably is the safest thing to do. You know, the last thing they would ever want to do is to get great grandma or grandpa sick that results in hospitalization. And I was just reflecting, a few weeks ago was Mother's Day. This year is my 45th wedding anniversary. It's the first time in 45 years our extended family has not gathered together to celebrate Mother's Day. But as my wife and I commiserated over the phone, it beats the heck out of being in an intensive care unit. And I think that needs to be our guiding principle.
Yeah, that's well said, Doctor. And Darlene, I'm sorry, this is so disruptive for normalcy in our lives. And again, June's a happy month for weddings. And I think the bottom line here is it can proceed, but there should be smaller numbers in attending with appropriate socially distanced policies, along with perhaps the idea of electronic viewing of the ceremony, and anybody with an underlying condition that would make them vulnerable or who's elderly probably should not attend. I mean, I think that's the best that we can say there. I'm sorry, my mind drifted as we were talking because my brother-in-law, who was 37 years old, died a month ago, and we had to do the funeral and the various aspects of the funeral in groups of 10. Even some of the family standing outside the church window for a portion of it. So it's just really traumatic. But anyway, it's a good question. Thank you so much. Let's now go to, hi, Bonnie. Are you on the line? Bonnie?
Yes.
Hi.
Hi. My question is, if you were exposed, how soon do you know if you have it or not?
Great question. Doc?
Sure. Well, Bonnie, first of all, there are a good number of people that are exposed and actually get infected who don't even know that they're sick. There was a recent report from a good number of sailors on the Theodore Roosevelt aircraft carrier who were tested, and a significant number of them actually were infected, and they didn't even know it. They were looking well and feeling swell. But for those of us who are exposed and get infected and become symptomatic, that is to say, we develop fever, chills, congestion, shortness of breath, chest tightness, those sorts of symptoms, there's somewhere between a 5 and a 7 day period between when the virus catches on and when people start to get sick. And, as Congressman Fortenberry said earlier, if there's a 5 to 7 day period there, and some are longer, some are 10 days, but there's at least a 2 to 3 day period that you are infected, you have no idea that you're about to get sick, and frequently very sick, and yet you are shedding large amounts of live virus. And that's one of the very unusual things about this COVID-19 pandemic, and that's one of the things that makes it so hard to control, is we have all of these people, thousands, tens of thousands of people who are running around, feeling well, doing their business, going shopping, running their farm or their ranch, and lo and behold, they find out that they're sick, but they also then find out that for the last 2 to 3 days, they've been with many other people, either in small groups or in maybe not so small groups, been to the grocery or to the pharmacy, and that's how the virus spreads. And that's why this is all so important to maintain the social distancing, use really good hand hygiene, sanitation. I really like the SSTT, the screening, sanitation, testing, and testing. That has got to be the key to putting this virus back in a box.
Thank you again, Bonnie. We really appreciate it. Maybe, Doc, if you could right now, if we could just talk about the best thing an individual person can do in their own capacity where they are. Last time we talked about you can make homemade solution that will kill the virus. It's 1 part Clorox to 10 parts water, as I recall. Wiping hard surfaces, particularly door handles. Frankly, I keep that solution next to my door, so if a package comes, I wipe it. Again, we don't know how long the virus can live on cardboard or a hard surface like tape, so that's a precaution that I use. We have hand sanitizers here in the office. We're trying to keep at least 6 feet apart. I've had to go back to Washington, D.C., which, again, it's hard to get there now because flights are so limited. So I think perhaps all the airlines have gone to this, but the one I was on, it's their rule now, and it wasn't 2 weeks ago, that everyone has to wear a mask. I'd seen pilots and others not wearing masks. Now everybody is wearing a mask. And so, again, if you have an underlying health condition, you have to add a layer of caution to your contact with others. Is that a fair summary of what we all practically can be doing right now?
I think that's a great summary, sir. Just the hand cleanliness, I think, is key, and the social distancing. There's nothing magical about the 6-foot number. I mean, as we all know, you can sneeze and cough lightly, and you can sneeze and cough, with a good deal of force. And it all depends on how severely ill you are. And so it's not like 6 feet is good and 5.5 feet is bad and 8 feet is better. And so with common sense has got to prevail in all of this. And if there's any question, particularly as you say for the older, more vulnerable group of folks, that extra ounce of caution is a good thing.
And then on another point, the system is rapidly moving to a place where what we call scalability is going to be here. In other words, instead of just waiting till you have symptoms and calling the doctor and then the doctor going through a checklist to see if it warrants testing, that's going to be much more readily available, easily available. The price is going to fall significantly, even though the federal government is covering that now. And then in addition to that, the antibody test, the blood test is going to be much more readily available. The University of Nebraska Med Center is positioning themselves to, again, be a provider of that level of service, particularly for institutions. Let's now go to Beverly. Hi, Beverly, are you on your phone? Are you on the phone, Beverly?
This is Don.
Hi.
I don't know why you always call me Beverly. I need
sorry,
to talk to
I'm sorry.
a good doctor.
Can you there's some background noise. Maybe it's a television. If you could turn that down, it'd be helpful for us to hear. You still there?
Yeah.
Okay, go ahead. Go ahead.
Talk to a good doctor.
Go ahead. Ask the doc your question.
The question, one of them's a compliment and the other one's a question.
Yes, sir.
The question is about the vaccine, and the compliment is that I've spent 15 years in the medical field, and I wore a mask in those 15 years about every day I worked. It didn't bother me any. And I think that UNMC is probably one of the best, and I mean one of the best, hospitals in the United States. You're doing one great job, man. One great job. And when it comes to the vaccine, there's something that's always bugged me is just recently we found out that a company is going into their second phase of the vaccine, and I've seen some of the people that was in the first stage. How come these companies, when they're using this vaccine, they do not use it and use it on the most vulnerable part of the population? I mean, the two people that I saw, one was a woman that was 40 years old, and one was a man that was 29 years old. How come not it isn't given to somebody at 70 or 80?
That's a good question, Doc. Maybe you could walk through the reasons for the vaccine protocols. I think these are early trials, but maybe you could walk through some of the reasoning and logic behind what people are now seeing in the news.
Absolutely. So first of all, you should know that there are over 90 companies in the United States that are at some stage of vaccine development. 38 are relatively advanced, and there's somewhere between 7 and 12 that are either in or about to be in what's called phase 1 or stage 1 testing. Stage 1 testing, which you just read about and described, which was just completed by this one company, involved 8 people. That is to say, less than a dozen. And it is a safety testing. It's not an efficacy testing. And so the idea is that if you're going to test a new medication of any type, particularly a vaccine, which is a preventive type of treatment, of course, you want to test it in younger people who do not have a lot of different diseases, because if there is an untoward reaction, think about fever, or perhaps they were to even get the infection, you don't want to do it in people that are older, at higher risk, or more vulnerable. Now, once they get into the efficacy testing, which occurs after the safety testing, and apparently these 8 people did well with only minor or no reactions, and they did make antibodies to the virus that were effective in the laboratory. When you get into the efficacy testing, which is going to be hundreds or maybe even thousands of people, that's when you really start to need to look at age groups, comorbidity, gender-related issues, geographic, altitude-related issues. All of those types of considerations become much more important, and that's when the prioritization needs to occur. The other thing that most people don't realize is that as you get older, you are less likely to make your own antibodies. And what I mean by that is even when you are exposed to influenza or even COVID, or when you're vaccinated against these diseases, you're less likely to have an antibody response. And that's why there are special vaccines for the senior citizens for the flu, for instance, because it's sort of supercharged. And the same thing is going to probably need to be done as these COVID-19 vaccines are developed. But in the early stages, where you're really looking for proof of safety and at least some efficacy, you really want to go for your younger, healthier population. I hope that makes some sense, because that's how it's typically done.
One more question, Doctor. What is your projection on the possibility of a development of a vaccine that's effective, safe, and readily available to the population at large?
Yeah, so you used all the key words there, sir. You used safe, you used effective, and you used readily available. So my thinking is that we will certainly have one or more vaccines that will be safe. We will have a variety of efficacy, and it's not clear. It may be something that has to be done annually, like the flu, and maybe hopefully it can be combined into a single vaccine that will handle both COVID and influenza. Scalable. There are a number of companies now that are actually building large facilities here in the States and around the world to manufacture literally millions, tens of millions of doses of a vaccine, even though the safety efficacy trials are really in their infancy now. So I am optimistic that we will have a good number of vaccines that will be scalable, maybe even by the end of the year or certainly by the beginning of the next calendar year. Will they be 100% effective? I must say I doubt it. But, very few things in life are 100% effective.
Right. It's a fair point. A lot of times we focus on the 2% problem, not the 98% potential benefit. So that's helpful to give it some perspective.
The 80-20 rule here, sir. If we can get 80% of this problem licked, well, let's declare victory. Yeah. Thank you. Again, everyone on the phone, this is Congressman Jeff Fortenberry. Thanks so much for spending a little time with us today. I have my special guest, Dr. Jeffrey Gold, who's the Chancellor of the University of Nebraska Med Center, an expert in this space of coronavirus, one of the nation's leaders, has a background in pediatric surgery and has had this pandemic cast upon him, but is well prepared for it because the university is a long leader in virology and infectious disease. If you want to ask me a question, I've got a number of them to get to. Please press 0. I'll try to get to as many as I can. But if you can't stay on the phone or I don't get to you, go ahead and press 1 on your phone and leave me your question. I'll review that, and if we need to get back to you, we will. Again, thanks for spending a little time with us today. Stephen, you've been on the phone a little while. Hi, Stephen. You there?
Hi, Jeff. This is your buddy Steve from Lincoln. I have a question for you.
Yeah.
With the money that we're saving when the Treasury interest rates just crashed to the bottom of the basement, would this be a good time for the government, the federal government in general, to try to refinance everything and save back some of the trillions of dollars that we have justly and rightfully been spending on helping people and helping businesses? I mean, with the interest rate drop, I would think that's kind of a golden rainbow for us that we didn't really expect out of something that is terrible and causing people a lot of problems. I would hope we could refinance the entire government debt. Would that be possible?
Well, the reality is the lower interest rate is due to the government itself. So we've driven down interest rates in order to create the conditions in which economic well-being can be assured. You're absolutely right that it makes it easier in the moment to borrow large sums because it's effectively very, very cheap. However, there are consequences to that too. There are long-term consequences of this debt, which gets passed on to children and grandchildren. A reconsolidation of debt is an interesting question. I'd have to look at sector by sector as to see how anything like that would be possible. But right now, I just got off the phone last week or so with the White House, one of the White House key economists, to walk through the consequence of what we're doing. It's not without consequence. We've just spent several trillion of your dollars, and then we've set aside several trillion more for facilities that can be used to borrow from in order to, again, create the conditions in which we are economically whole or as close to being whole once we can get back to work and create some sense of normalcy for our health care. So right now, as I recall, the interest payments on the debt are about 8% of the overall federal budget. So when you run up this amount of debt, you're actually crowding out the investment in other public goods because you have to pay back the debt. So we have to be a little bit careful about this. I get your question. I'd want to think a little bit more deeply to see what options there are in terms of the various segmentations of debt that could be looked at in terms of consolidation. I mean, obviously, those of you who have mortgages, you want to undertake a personal look at your current financial situation and maybe refinance because, again, they were this low previously in about 2013, as I recall. But it's a good time at a personal level to go ahead and refinance that. But calling back debt in order to refinance, that's another dynamic that I don't want to get into at the moment. But the borrowing is very cheap, but it also has very significant consequences for the long term. So this isn't free money, what we're doing. It is a necessary investment, if you will, in the future of America in order to save our country, save our economy, save our healthcare system. So I'm sorry I don't have a better answer for you, but on a personal level, you should definitely consolidate your debt. So let's now go to Kit. Hi, there. Are you there? Kit, are you there? Hi. Kit? Remember the Wagner family? Oh, sorry. Okay, let's go to the next person. Linda, are you there? Hi, Linda. Are you there?
Yes.
Hi there.
I saw on Facebook today that another stimulus check was going to be issued to everybody again, and it was going to be issued whether you're a citizen or not. Is that true?
There was a proposal for another stimulus check, and I'd have to double check if it was possibly going to end up in the hands of persons who are not U.S. citizens. I don't. This was in the last bill that went through the House of Representatives last week. I'll be up front with you all. There was a bipartisan airlift over the last three bills in which we worked, Democrat and Republican, to, again, do three things: protect our healthcare system, protect individuals and families with a little bit of support, and protect small businesses with a type of loan program that can keep them whole and keep people working. We also significantly increased unemployment benefits for those who are caught in this difficult time, as well as support for farmers and ranchers and those who have food insecurity. These were good bills. They were necessary bills. They were unprecedented. They were massive. They were hard to swallow because, again, it cost us in the trillions of dollars. However, this last bill was $3 trillion more with a whole variety of things unrelated to coronavirus. I voted no. A lot of people voted no. It's not going anywhere. It's not going to happen. So we have a stalemate right now between the House and the Senate as to what the next steps are. I would not count on, honestly, there being another round of stimulus checks coming to individuals. It's possible as a part of the negotiation in the next bill, but there's no clear pathway for that. The biggest issue out there right now is, again, some additional help for local governments who did not receive any help in the first round. We've been working aggressively with the Treasury Secretary to allow the existing funds, which haven't been all spent, to go toward police and fire, as well as first responder services, which are big portions of local government budgets. And we think that's a good way to proceed without burdening you all with another amount of debt. But I'd have to say at this point, no, there is not a plan that is realistic for another round of economic support fund stimulus to individuals.
Okay, thank you. That's kind of what I thought.
Yeah. All right. Thank you, Linda, for the question. Let's now go to Benjamin. Are you there?
Yes, I am.
Yes. Hi.
Hello. I was just wondering if you could address the amount of cases that are coming out of China and whether or not, if their numbers are accurate, why we aren't asking them for help, and if they aren't accurate, why we aren't calling out how fake their numbers are and getting an answer from them one way or another.
I'm speaking for myself, not Dr. Gold, so he might not speak in these kinds of tones, but we cannot trust China's numbers, period. They were more interested in controlling their information than controlling the virus in the initial stages. This lost precious time. They have not been in solidarity with the international community on how to fight this. Along the number of years ago, it actually was fairly recent, within the last year or so, the Secretary of State became before my subcommittee. I sit on something called the State and Foreign Operations Subcommittee of Appropriations. That means we control the funding for diplomacy, certain national security operations, as well as humanitarian aid. And I asked him a question. I said, Mr. Secretary, how much does China give in humanitarian aid to the world? The United States gives about $25 billion, by the way. And this is important for a couple reasons. We just don't sit around while other people die. It's not who we are. Secondly, we benefit from this economically and culturally as we exchange goods and people. But third is it's important to national security, where you have stability, where you have food security, where you have health security, you have stable governance and stable society, and that prevents the possibility of conflict. So this is very important for our own national security. But the Secretary of State looked at me with a troubled look. I'd never seen him wanting for an answer. He didn't have an answer as to how much China gives away in humanitarian aid. And I wasn't meaning to put him on the spot. I was trying to make a rhetorical point that they don't do anything. And at the same time run around the world and extract resources and have a sort of philosophy of economic nationalism, and they want to claim superpower status, which they are, and rightfully deserve respect and respect for a long history and culture. Yet at the same time, if you want superpower status, you have to have superpower responsibilities. And this COVID-19 virus has shown us something else, just how dependent we are on drugs and medical equipment supplies from China. And it is a very great vulnerability. From my perspective, just like our military equipment is made in America, so should our drugs be made in America. I have oversight responsibility for the Food and Drug Administration as a part of my responsibilities. It's a strange title, but I'm the ranking member, what's called ranking member of the Agricultural Appropriations Subcommittee. Therefore, part of that work is, again, providing the policies that create stability for farmers and ranchers, as well as create the conditions for food security and have oversight over the Food and Drug Administration. Food and Drug Administration are very much in alignment with the perspective that I just gave. We are vulnerable to disruptions in our drug supply as well as safety because so many are made and the precursor, the ingredients are made in China. So you got me a little bit off track here because I've obviously give this a lot of thought given my responsibilities in Washington. But this is, I think, a very important perspective. If you hadn't heard me lay it down, I've laid this down before publicly, so I wanted to be very clear with you. Does that help answer your question, Benjamin?
Yes, it does, and I've heard you, and I appreciate your sentiment on this. But I would only ask that, and I completely agree with what you're saying, and mine was a little rhetorical. My question was a little rhetorical as well, but I just wonder if when you're in front of the press, if you could push that point, is that we either need to be asking them for help, and if you think their numbers are fake, why can't we, push them on that? It's kind of it's a two-sided coin that no one's really taking a look at either side on.
Well, the relationship is very deeply wounded. We need a good relationship with China. It is a deeply wounded one. We cannot trust their numbers. That's my bottom line. Doc, I don't know if you want to add anything or you want to stay out of it. If you want to stay out of it, I understand.
Well, there's just been an awful lot of debate as to the accuracy of their numbers, some of the drug trials, some of the reports about vaccine development, et cetera, that are just all over the place. And I'd say your sentiment is widely appreciated among the healthcare professionals as well. The truth is, at this time, anything that's not really scientifically based has to be taken with a significant degree of skepticism, frankly, from almost any place these days. I mean, there's just so much one-off anecdotal experiences, et cetera, and that's particularly true for some of the early data from China.
Thank you very much, Benjamin. Thank you, Doctor. Let's now go to Tony. Hi, Tony. Are you on the line?
Yeah, I am.
Hi.
I have a question for the doctor. Being at the university in Omaha, when does he expect students to live on campus and not just in-person classes?
Well, Tony, we still have students living on campus, on the UNO campus, and those are particularly international students. We have a good number of students that live in our apartment dwellings 12 months a year. We've put a lot of precautions in place to make sure that living is safe in terms of surface cleaning, look at all of our air handlers and things of that nature. And for our returning students and our new students that are going to be joining us in the fall, we have every intention of offering a full residential experience for these students. Obviously, we're going to, quote, de-densify. That is to say, we're going to make sure that there's appropriate social distancing, that all of the necessary personal protective equipment, screening and testing is there. And, one of the things we have not talked about is the use of this smartphone app that we've developed. It's called One Check COVID. That would be number one dash the word check COVID. And this is now available on both the Apple and the Android platforms. And it is a screening tool that's totally confidential that allows individuals to self-screen. And so one of the things that we're doing with our students who are living on campus is we're asking them to self-screen probably on a daily basis. And if the screening comes back with anything other than, you're okay, or a green light, as we call it, then they need to let somebody know. So safety is the top of our priorities for university life. in the classroom, in the research lab, in the dorm, in our athletic settings. It's all about safety.
Okay, great. Thank you, Doctor. I appreciate it. Let's take a few more questions. Again, thank you all who have stayed on the line. We're talking with Dr. Gold. This is Congressman Jeff Fortenberry, Dr. Gold, Chancellor of the University of Nebraska's Med Center. We'll try to squeeze a few more questions in. If I don't get you, go ahead and press 1 on your phone and leave me a message. I'd like to hear what question you had, and I'll review that. And if we need to get back to you, we will. Or, again, you can always go to my website at fortenberry.house.gov and leave me a message there. I also encourage you to sign up for the Fort Report. It's a weekly or so email that we send out with on a variety of topics of public policy or topics affecting our home state. So let's now go to Kimberly. Hi, Kimberly. You've been on the phone a little while? Go ahead.
Yes, I have. Thank you. I have a couple comments, but a question too. I don't trust China. I hope that you continue to not trust China, and I would strongly suggest no on illegals receiving payments or free money. I feel that they already get enough of our tax dollars. They're here illegally. That's the word. There's a process they can come in our country if they want, and they should do it that way. If not, I'm strong about that. Anyway, my other thing, I have a couple things. I have to have a surgery, and I just got a call from them, and I missed it, but I have to call them back. They want to schedule a back surgery in June, and I'm not too confident because of our numbers right now are going sky high. Are we really doing elective surgeries? Because I'll be there for 4 or 5 days. It's a back surgery. And I'm just not real confident because when I go to this grocery store, I wear a mask, and I see multiple people not wearing masks, gathering, going the wrong directions in the store. You know, I bleach everything when I get home. I'm obsessed with it. I don't go anywhere except for what I have to get. And I just don't know if I should do that surgery. Do you really think it's safe to do that surgery with our numbers still going up? And then how come Nebraska people can't enforce other people to at least wear the mask? I understand.
Well, I'm sorry, Kimberly, I cut you off there. I apologize. I hit the button too soon. But nonetheless, I think we can let Doc wade in the question about your own decision whether or not to go forward with surgery. Obviously, it's a little bit personal and depends on a lot of circumstances, including your underlying conditions. But let me take a shot at the mask question about enforcement. It's a delicate issue. We're trying the best we can. Fortunately, in Nebraska, let me put it this way, many people are just very good about compliance. We have a compliant citizenry. We view government as a partner in our own protection, not necessarily one that's eroding or trying to take away our freedoms and civil liberties. That's why we just don't have the same kind of debates generally here as are occurring in other places where you're seeing governments act in a very authoritarian, heavy-handed way. And yet at the same time, we're trying to be sensitive to the issue of personal responsibility as well as social responsibility, for the public good. So there's a delicate balance there. I think most people are being very compliant, are willingly, voluntarily trying to wear a mask and do things. I have to remind people every now and then who stick out their hand and want to shake their hand to me. I just hold my hand up and say, sorry, you can't do that right now. And it just reminds people, and they accept that, and it's fine. So I think it's just a matter of conditioning ourselves to get used to this. Yes, you're going to have some people that are defiant about it. Just take the other grocery aisle. That's what I'd recommend. All right, Doc, do you want to weigh in on the surgery, or is that just a little?
So, yes, most of the hospitals in the state are going back to elective surgery. What I know best is what the Med Center is doing, and we are offering elective surgery. We are requiring pre-surgical testing, including COVID testing, for all of our patients. We use absolute top-of-the-line personal protective equipment, sanitation, air handling, etc. And indeed, to the best of my knowledge, we have not had any patient-to-patient spread in spite of the numbers of patients that we have cared for. And we've only had, to the best of my knowledge, one instance of a staff member who got infected as a result of caring for patients, and that was in very, very early days of personal protective equipment. And so I do think it's safe, but I think to the Congressman's point, depending on how symptomatic you are, what the urgency of the surgery is, that's a discussion to have with your physicians and decide whether you want to put it off or not. There's a lot of time between now and June, as it's going to, particularly mid and late June, as it's going to relate to the changes in the respect to this pandemic spread. Why don't you make the decision a week before?
Okay, good advice. Thank you, Doctor. And now let's go to John. Hi, John, are you there? Hi, John. Uh-oh. John, oh, okay. John, are you there? I heard a baby. Did someone say John's coming? All right, sorry. I need to move on to the next person.
Hello?
John?
Hello? Yeah.
Yes.
Hi. I was just wondering, the Trump administration came out and said that they had information and evidence that the Wuhan virus came from the super lab in Wuhan, but then the university, the UNMC specialist on bioinformatics said that it wasn't made in a lab. So who am I supposed to believe, and who do you believe?
It's a fair question, John. I thank you. You might have heard me talk earlier about the deep distrust there is with China. Again, more interested in controlling information than the virus itself. I think China made absolutely critical mistakes, inexcusable mistakes, in not, again, sharing information robustly and rapidly with the international community so we could all act in solidarity to try to stop the pandemic, maybe even help China. Instead, again, because of the control of information, the poor quality of understanding of the impact of the disease in China, because, again, we don't trust their numbers coming in and out, have led to a lot of theories. Most scientists that I've heard talk about the virus say that there is significant evidence that it emanated from what they call the wet market, which is a live animal market, and was transferred to humans. And so that's what the most people in the science community will say. However, there has been some suggestions from intelligence that there's a possibility of leakage in other theories from a nearby lab. So that's the state of play at the moment. Is that a fair summary, Doctor?
Yeah, I'd say that's fair, sir. There is no question that many of these viruses, think Ebola, coronavirus, and many, many others, SARS, start off in these bat caves in all around the world, in Africa, the Far East, etc. But what happens after that, is really very much unknown. There's been a good deal of work from tracing the genetic, material in this virus that has looked at the patterns of spread from Europe to the United States, from China to Europe, and to the Middle East. I don't know if we'll ever answer the question as to where the virus emanated from, but right now, from the Med Center's perspective, our biggest job is to help prevent the spread in this country, to try to help develop good antiviral treatments, and to work very hard on testing and vaccines. And that is what occupies us 24/7.
That's well said, Doctor. And John's going to have the last word, or you, Dr. Gold, will get that last word on what our obligation is now. Yours is to cure people and to help prevent this disease and help lead our nation. And I want to thank you publicly in front of everyone here who's still on the call. For those of you who did not get to ask me a question, I'm sorry. I would like to hear your question, though, so if you'll press 1 on the phone and leave me a message, I'll review that. And I'm very grateful, again, for your willingness to take a little time. It's been a good discussion about a whole variety of things. My job as your federal representative is to do 2 things at once: to make sure that you are safe, to make sure that we restore economic well-being, so that as we fight our way through this coronavirus, the federal response is, again, protecting health care, protecting individuals and families, and protecting small businesses, doing a 2-step process at the same time of ensuring that we are, again, fighting the disease appropriately with the right types of health care resources, and fighting back so that we can restore some normalcy to your lives, to help get people back to work, and to help create the conditions in which we can be whole as a society again. So it's tough. There's so much suffering and difficulty out there. So many people are facing unemployment or shortages of food. So many people have uncertainty, particularly those who are running businesses. Thank you all for all that you're doing, for being responsible citizens. Again, we'll continue to work hard on your behalf. We are here. We are here to help. Even if you have what you perceive to be a small need, again, please let us know, and we'll try to work through it with you. Again, thank you, Dr. Gold, for the informative conversation. We're so grateful for your leadership. And Dr. Gold and I are staying in touch on a regular basis. He is a great, tremendous asset to me as I'm trying to learn more about the latest trends of the virus. And I seek his counsel as well on public policies, again, that makes sense to assure the integrity of our healthcare infrastructure. So, Doctor, thank you so much. And everyone else, have a good evening. And we'll continue to be in dialogue with you as you move forward. Take care.
Thank you. Good night.